When a patient is being admitted here for a surgical procedure, we have a few different forms that we need to keep on file for that patient. One is the anesthesia consent form. We've got our anesthesia and sedation record, and then we also have home care instructions for the owner to go home with. But I was going to start with the patient's permanent record. We are a paper light clinic, so all of the permanent record is actually on the computer. So you'll see the owner's information, the patient's information, all of its vaccine history, and then if you scroll down, you'll see every single thing this patient has been for. You can open, for example, if you need doctor's notes, we also have them under the medical condition, so it opens up and you can see the patient exam notes as well. So everything is kept electronically in this clinic. As far as the surgical procedure, the owner has to fill out an anesthesia consent form, so it's just authorizing us to do the procedure, which in this case was a declaw. We give them the option of doing pre-anesthetic blood work, IV fluids during the procedure, a pain laser for afterwards, and then also if they would like their pet microchipped, and then the owner just has to sign and put the best contact information for them for that day. The second important piece of paper we need is the anesthesia sedation record. So that has all of the patient signalment up top, as well as the patient number that coordinates with the online file. And then we're going to put all of our pre-anesthetic medications on here, our induction medications, and also medications to go home. So in this case, we pre-medded with some kitty magic, so butorphanol, dextromethorphan, and ketamine, and then we sedated with isoflurane and maintained on ISO during the procedure. And then to go home, we're going to be sending home some buprenorphine for pain. And then you'll see on the back where we actually keep record of their heart rate, their respiration rate, and their blood pressure while they're under anesthesia. So we're supposed to record every 5 minutes. This is a short procedure, so we only needed to get those values one time. Some technicians will also do every 15 minutes depending on the procedure at hand. So that's what our anesthesia record looks like. And then go home instructions, it's just a pre-filled out go home instruction sheet that we fill in the pertinent information. So when to start medication, when the patient can be fed and what it can be fed, what kind of exercise the patient is allowed to have. So in this case, they need to confine inside for the next 2 weeks, no running or jumping. If they have sutures and when they need to be removed, any follow-up appointments that are necessary, and then we also put things to look for, so loss of appetite, vomiting, bleeding, excessive pain, things like that. And then at the bottom, we just put on here to use yesterday's news or newspaper shredded for the next 2 weeks since this was a declaw. So any other information could go down in that bottom section, and we would just have the client sign as well as one of us sign saying that we did the discharge. And then the last piece of information we need is a proper identification for that pet while they're in hospital. So we use cage cards, and you just want to put the patient's first and last name, what they're having done, the date in which they're here, and then we always put the doctor's initials that they're seeing and also how much the patient weighs. And then we would transfer that weight to the computer.